Welcome to physical exam in the Maxfield home in the dining room. So first I'm going to introduce myself to the patient. Say good morning, my name is Courtney. I'm here to do your physical exam. Of course, while I'm in here, I'm going to wash my hands in front of the patient. I'm going to assess. Tobin, why are you here today?
Physical exam.
Good. I'm going to make sure that she's alert and oriented, and also noting her cognition and behavior. I'm also going to review her vital signs as per my medical assistant, her blood pressure, respirations, pulse, as well as her height and weight. Tobin, today we're going to do your physical exam from head to toe. Just let me know if I find anything that's abnormal or tender. Just let me know. Okay? Any questions before we begin?
No.
So we're going to start with your skin and your head on your face, and we're going to look at your skin. It's pink, warm, and dry. As I look at your hair, I notice that it's clean. I'm going to be checking for any infestations as well, or any lesions. Are you aware if there's any soreness or any problems that you've noted?
No.
I'm going to just kind of run my hands through, feeling for any nodules. Okay, let me just go through the back. Catches. Good. I don't feel anything unusual. I wanted to check some cranial nerves. The first one we're going to check today is number 5. Cranial nerve 5 is the trigeminal. Go ahead and clench your jaws real tight for me, and then move your chin side to side. Good. Cranial nerve 7 is our facial nerve. Go ahead and raise your eyebrows. Good. Make sure they're equal and symmetric. Go ahead and puff your cheeks out. Good. And smile for me. I'm looking for the symmetry in all those. We're going to move on to your eyes. Go ahead, Tobin, close your eyes. I'll make sure her eyelids close all the way, that the lashes on top go up and the lashes on the bottom go down. You may open your eyes. The next thing we're going to do is look at the lacrimal duct. I note that there's no drainage from here. Let me just kind of palpate a little. Good. Is there any tenderness as I do this?
No.
No drainage is noted. I'm looking at the conjunctiva and they are pink and moist. Go ahead, Tobin, we're going to look into your eyes at this time. I'm going to be checking your pupils. I'm looking at the size and the shape, whether they accommodate light and then constrict. Go ahead and just look straight ahead. Perfect. Good job. I'm just going to look at this one as well. Good. Everything looks great. I want you to cover one eye. Good. And uncover. Okay. I cover the other eye. And uncover. Perfect. There was no extra movements with your eye. Look straight ahead. I'm going to look in here at the corneal reflex, and the light is noted right in the center of her pupil, reflected. I'm going to do a fundoscopic exam. That goes and looks all the way in to your eye. So if you would just keep looking over my shoulder, I'm going to get very, very close to you. And come in really close. Okay, so I see the red disc, I see the optic nerve, and I see the retina. Wonderful. The last thing we're going to do is test your field of gaze. So you're going to follow my finger as it moves through a star pattern. Are your eyes okay after doing that? So just follow my finger. This is cranial nerves 3, 4, and 6. And then we're going to go in. Perfect. And her eyes do cross. That's all for the eyes. Let's move on to your ears. Next, I'm going to notice the position of your ear. The outer pinna should be in line, or the pinna should be in line with the outer canthus of the eye. I'm going to look at the pinna and the tragus, looking for any nodules or tenderness. Anything hurt as I palpate?
No.
Let me look into your ear canal. And get our head back on. Okay. So as I look into the ear canal, I'm going to pull your ear out and up and looking for this tympanic membrane. It is nice and gray, dull. I'm looking for the cone of light. It should be at 7 o'clock on the left and at 5 o'clock on the right. I'm also going to test your sense of hearing, which the MA should have done, and that's cranial nerve number 8. I'm going to go ahead and move on to your nose. I'm going to look and make sure it's symmetrical in your face. I'm going to palpate down the bridge. Any tenderness? No. I'm going to go ahead while I'm here and palpate your lymph nodes. Your sinuses. These are not lymph nodes, these are sinuses. Perfect. Any tenderness?
No.
I'm going to go ahead and look inside your nose. There's no drainage noted. As I look in the nose, the mucous membranes are pink and moist. I'm looking at the septum and any turbulence. Go ahead and check for patency. I want you to hold one side and blow out. Good. And the other. Good. Any, do you have any trouble with tasting or smelling?
No.
That's cranial nerve number 1. We're gonna go ahead and move to your mouth. I've been watching her lips move, and they've been symmetrical with as she talks. I'm also, as she's talking, assessing cranial nerve 12, hypoglossal, and her articulation has been good. Her lips are symmetrical, there's no lesions, they're pink. Go ahead and open up. I'm going to look at the buccal membranes, looking at the gums as well. They should be pink and moist and no lesions. I'm looking at your teeth, they're all present. I don't see any obvious dental caries or any major dental work. I want you to go ahead and stick out your tongue. It's nice and midline. I don't need you to say ah yet. It's just midline and pink and moist. There's no lesions. Raise it up so I can look underneath it. Good. There's no obvious breath odor noted either. Next, I'm going to go ahead and have you say ah. As I do this, I'm just looking at the uvula. It is midline. You relax now. It's midline. There's a gag reflex present, and that is cranial nerves 9 and 10. I'm also going to look at the tonsils. Go ahead and open up one more time. Stick out your tongue for me so I look at your tonsils. There's no obvious exudate or crypts, and then you would also grade them from 0 to 4. They are pink and moist. Tobin, I'm going to go ahead and move on to your neck. Can you move your neck up and down as I test your range of motion side to side? Can you go around in a circle? Good. Any pain or discomfort? No. No. I'm going to go ahead and feel lymph nodes. I'm going to do your posterior and then the anterior, submandible and submental, and then clavicle. Perfect. I don't feel anything there. I don't know why I straightened your shirt. We're just going to keep you all put together. So as we do this, I'm also going to look at your carotid arteries and looking for jugular vein distension. I don't see anything when you're sitting up, but sometimes you can see it when you're lying down. And when I take your pulse, I'm only going to do one side at a time. So if you don't mind, I'm going to feel your pulse here. And it should be 2+, and they should be equal on both sides. I don't have my stethoscope. Can someone bring me a stethoscope? It's on the bed. So I could listen to your carotid arteries with the stethoscope, noting if there was any bruise. Don't you love when you forget stuff? I've got a whole pile of things laid out and don't have what I need the most. Any questions so far? Okay, we will come back to listening to that as we go ahead and move on. Let me do your upper extremities. I'm going to assess your clavicles and your shoulders and your scapula. Okay, thank you for the stethoscope. Let me go ahead and listen for those bruises now. No bruise are noted. So as we have already assessed your upper arms, so your clavicles, your shoulders, and your shoulder blades, your scapula, everything is equal. I'm going to and symmetrical. I'm going to go ahead and look at just one arm at a time. I'm going to palpate all of your joints. Is there any tenderness at any of these? Good. I'm going to go all the way down your fingers, your thumb. Any tenderness at all? Okay. As we do this, I want you to go ahead and do a range of motion. You can put your arm up and out, behind you. Can you rotate it around? Good. Over your head and behind. Good range of motion. Any tenderness as you do that. Elbows are easy, just up and down. And your wrist up and down and around. Perfect. And fingers all move well. Okay. I'm also going to be checking pulses. So we're going to do a brachial pulse. Should be 2+. And of course, on both sides, we want them equal. A radial pulse should be 2+ or better and equal. Let's go ahead and try to feel for these deep tendons. Okay, I'm going to find the tendon here. Good. Okay, relax for me. Are you relaxing this? Good. Good. Are you relaxed? I don't believe it. Good. Okay, so let me get your tricep. Got to hold it out and just let it dangle. I'm going to feel this tendon. Make sure I'm still on this camera. Good. Okay, everything looks good on the reflexes. I'm also going to, as I felt down, I'm going to look at cap refill, which is less than 3 seconds. And if you would squeeze my hands nice and tight, good. They're equal on both sides. So that's all we need for our upper arms. I'm going to move on to your back. As I look at the back, I don't know how much the camera, okay. So as I'm looking at her back, typically she would be exposed in a gown so I can actually see everything. As I'm doing this, I'm looking at the skin. Are there any bruises? Are there any marks? Are there any piercings? Are there any scars or unusual markings? I don't see any at this time. I'm looking at the AP and thoracic diameter. It should be 1 to 2, a ratio of 1 to 2. I'm also going to make sure that her lungs expand evenly. Take a big deep breath for me, and my hands should move evenly. Perfect. I'm going to listen to all the lung fields. So open every time I put my stethoscope on, if you don't mind, to take a deep breath for me, and we'll listen to all of this lungs. Good. Good. Perfect. Good. Way down here. Good. I'm also going to listen to the lateral aspects of your lungs. Good. One more time. And I'm going to listen to the front of your lungs and the anterior. Good, one more time. Good, everything sounds normal. So now we're gonna work on vocal and tactile fremitus. Every time I touch, I want you to say 99, okay? So I'm gonna be listening. As I'm listening and going down her back, it should be muffled and indistinct. Okay, Tobin, ready? 99.
99, 99, 99, 99, 99, 99.
Good. So now we're going to do the tactile fremitus. Same concept, say 99 every time my hands hit, and I should feel less vibrations as we go down. Ready?
99, 99, 99.
Perfect. Now let's move to your chest. As we do the chest, we've already listened to heart, our lung sounds, so basically it's just the heart on this time. I am going to look at your chest as well, again looking for any piercings, any scars, any unusual marks or moles. I'm going to listen to your heart sounds. I'm going to the second midclavicular, apical, and one. And listen to the tricuspid at the fourth, and at the fifth intercostal space. And listen to my vocal. I'm listening for S1 and S2, any murmurs and unusual sounds. So I'm also going to, while you're sitting up, try to find the point of maximum impulse. Sometimes it's the same, sometimes it isn't. But go ahead and lay back. I'm going to listen to your lung sounds in the same area. So I'm going to listen to the 5 lung sounds as you lay down as well. So again, aortic, 1, good. Your tricuspid and your mitral valve. While you're lying here, let me try to palpate your apical pulse. So I'm going to go to the 5th intercostal space, just left of the midclavicular line, and feel this pulse. Good job. Okay, we're going to move to the abdomen. As we go to the abdomen, again, if it would be exposed, I'd be looking for any, inspecting the skin. Again, scars, piercings, unusual moles or problems. I'm going to look and see if it's symmetrical and what the shape is, whether it's round or flat. As I'm doing this, I'm next going to listen before we stir anything up. So I'm going to listen to your bowel sounds in all 4 quadrants. And I'm also going to listen to your vascular sounds. So we're going to listen to the aortic. I'm going to try to hear your renal. I'm going to go down to the iliac and the femoral. Next, I'm going to percuss your abdomen. Okay, so I'm just going to. It's harder to do when you're laughing. Good. I'm listening for that dullness or that tympani. So once I percuss, I'm now going to assess your liver. I'm going to go down. And then once I hear that dullness, I'm going to put a mark there. And I'm going to come up. About there. And it should be like 4 to 6 centimeters, which seems appropriate. So I'm going to try to feel your liver, okay? Are you ticklish? I want you to go ahead and take a deep breath in Okay, I'm gonna try to cup my under my fingers. Take it. I think they're really ticklish. Go ahead and take another deep breath and let me try to feel. Good job. I'm also gonna do the same with your spleen over here. So right here, you're not being an easy patient. I'm gonna try to feel this spleen. Okay, so we're gonna percuss down. And then we're also gonna feel for it. Good. Okay. So now I'm going to go ahead and palpate all over your abdomen to see if there's any soreness. Right, this tendon with everybody. We're gonna have to move past your abdomen to get the giggles to stop. Any tenderness at all as I do this? Good. Yeah, it's tender there. Okay, so let's do some rebound tenderness. We're gonna push in and come up really quickly. Any soreness there? And up. Good. Let's try McBurney's point. So I'm gonna measure from your superior iliac crest 2/3 to your umbilicus and press here. We've already had an episode of appendicitis with Tobin, and we're able to assess that and get our appendix out just a couple years ago. So we're very familiar with that, aren't we? The last thing I'm going to do is try to assess your kidneys. It's a really deep palpation, and it's really hard to feel, but I don't feel anything, and there's no tenderness noted. While you're laying here, let me go ahead and assess your hips. Okay, I'm going to squeeze in and down. Okay, any tenderness there?
No.
Go ahead and move. Let's go ahead and check your range of motion. Go ahead and pull this. Okay. If you'll relax, let me move. Go ahead straight up and okay. And bend your knee here. In and up. Good. Any pain with that? Okay. You want a hand up? I'll give you. There you go. So your hips feel perfect. Range of motion is good. As we get further down, we're going to do your lower extremities. We're going to start with your knee. I'm going to inspect, palpate, and assess this knee. Any tenderness there? Let's go ahead and do a range of motion, up and down. Good, good. I'm going to also go ahead and check. Dangle, dangle, dangle. Good. Dangle. Can you see? Okay, perfect. So that reflexes there. We're going to go a little bit further down to the ankle. I don't know if you can see. I think we can see ankles. We're going to inspect and assess this ankle. I'm also going to I want you to hold your foot here. Relax this. I'm going to check this Achilles. Good. Her foot comes up. And then Babinski, I'm going to kind of, she's has a good Babinski. So I'm doing range of motion with an ankle. So up and down and around. Perfect. Everything looks normal there. The last thing we're going to do is almost the last, the neurological exam. Tobin, can you take your heel and run it up and down your shin? Okay, now can you do the other one? Good, that's dystaxia. Okay, I want you to close your eyes and we're gonna do a couple of things. Okay, so go ahead and cross your legs. I want you to tell me if your toe is up or down.
Up.
Good. Okay, do you feel equal touches?
Yeah.
Does everything feel the same? How about heat and warmth? Are they feel equal?
Yeah.
Okay. I'm gonna, do you feel sharp or dull?
Sharp.
Good. Is that sharp or dull?
Both.
Good. They feel equal everywhere I'm touching?
Yes.
Good. I'm gonna place an object in your hand. Can you tell me what this is?
The key.
Correct. I'm gonna take that back. I'm gonna give you another object. Are you able to tell what this is?
Coin.
A coin, yeah. Nickel to be exact. Okay, now I want you to tell me if it's like if there's 2 points or just 1 point as we touch.
2.
2, good.
1.
Good. And on this side?
1. 1. 1.
Good. Okay. I guess I should give you a 2 point, right? Okay. The next thing I want you to go ahead and you can open your eyes now. I want to see how you walk. So go ahead and stand up. Take a few steps towards the window. That way you can walk this way. Go ahead and walk towards the window. Good. Turn around. I want you to walk on your tiptoes. Good. Okay. Can you turn around and walk back on your heels? Good job. Now as you come back heel to toe. Just right in front of, one in front of the other. Good. Okay, so I want to test what we call a Romberg exam. So I want you to hold your hands out, close your eyes, We're checking for any dizziness. I'm here to catch if you were to lose your balance. You can open your eyes now. The last thing, I want you to go ahead and turn maybe this way. Okay, so I'm gonna assess your spine. I'm looking to make sure that I posture and the symmetry bilaterally. Go ahead and do what we call a dive pose. Okay, down, arms together. I'm gonna palpate her spine and the muscles along it. Any tenderness?
No.
Good. Okay, and then I want to do range of motion. So go ahead and touch your lean forward.
Oh.
Now lean back and kind of arch your back as you come back up. Can you go backwards? All the way up and back. Good. Okay, now side to side. Go this way, and then twist. Twist, and then twist the other way. Good. And then I want you to, there's one more thing. And I can't think of it. So we did your spine, we did side to side, and we will call that all. Okay, thank you so much. I appreciate your help and your time. Just in case you want to see, there were no note cards. I don't know how to turn this around, just my supplies, including the stethoscope that I had forgotten. Thank you so much.